The human skull is made up of 22 bones that are classified as cranial and facial. There are a total of 8 cranial bones and 14 facial bones. There is one frontal bone, one ethmoid bone, one sphenoid bone, temporal bones, 2 temporal bones, 2 parietal bones, and 1 occipital bone. The different anatomical views of the skull are called the normas. If we are viewing the skull from the front, this is called the norma frontalis. From the sides, this is the norma lateralis. From behind, this is norma occipitalis. Superior view is called the norma verticalis, and from the base is the norma bassalis. The inside of the skull is naturally divided into 3 main fossas: the anterior, middle, and posterior cranial fossa. The anterior cranial fossa is bounded anteriorly by the frontal bone, posteriorly by the lesser wing of the sphenoid, anterior clinoid process, and sulcus chiasmaticus. Laterally, the orbital plate of the frontal bone forms the roof of the orbital cavity, and in the midline, the cribriform plate of the ethmoid forms the roof of the nasal cavity. The cribriform plate of the ethmoid has small pores in it, which allows the passage of the first cranial nerve, the olfactory nerve. A tooth-like process, the crista galli, is present in the midline, and a foramen cecum is present just anterior to the cribriform plate. It is usually blind-ended, but if it is patent, it allows the passage of emissary veins. 2 canals, the posterior ethmoidal canals and anterior ethmoidal canals, are present on the anterior and posterior ends of the cribriform plate. A crest is present anteriorly, which is called the frontal crest. The frontal crest and the crista galli provide attachment to the falx cerebri. This smooth area in the midline posteriorly is called the jugum sphenoidale. The middle cranial fossa is bounded anteriorly by the lesser wing of the sphenoid, the anterior clinoid process, sulcus chiasmaticus, and posteriorly it is bounded by the petrous part of the temporal bone, the dorsum sella, and the posterior clinoid processes. The middle cranial fossa is formed by the body of the sphenoid, the greater wing of the sphenoid, this area, and the squamous part of the temporal bone here. Now let's discuss the foraminas of the middle cranial fossa. Firstly, we have the optic canals. The optic nerve and ophthalmic arteries pass through these. Then we have the superior orbital fissure. The 3rd, 4th, and 6th cranial nerves pass through this opening and enter the orbital cavity. The first division of the trigeminal nerve, the ophthalmic division, also passes through this foramen. Then we have a rounded foramen, the foramen rotundum. The second division of the trigeminal nerve, V2, the maxillary nerve, passes through this opening. The foramen ovale. The third division of the trigeminal nerve, the mandibular nerve, the lesser petrosal nerve, emissary vein, and accessory meningeal artery pass through this foramen. A small foramen just lateral to the foramen ovale is known as the foramen spinosum. The middle meningeal artery passes through this foramen. An irregular foramen present posterior-medially is called the foramen lacerum, and a canal which is oblique is also present just lateral to this foramen. This is the carotid canal. It passes through the petrous part of the temporal bone and exits through the base of the skull. The Vidian nerve or nerve to pterygoid canal is formed in the foramen lacerum by the junction of the greater and a deep petrosal nerve. The internal carotid artery passes through the carotid canal and enters the skull, and it just passes through the foramen lacerum and enters into the cavernous sinus, which is present on the lateral sides of the sella turcica. This depression in the middle is known as the hypophyseal fossa or the sella turcica, and the pituitary gland is present here. The posterior cranial fossa is bounded anteriorly by the petrous part of the temporal bone, the dorsum sella, posterior crinoid processes, and posteriorly it is bounded by the occipital bone. The posterior cranial fossa is formed by the squamous part of the occipital bone and the mastoid part of the temporal bone. It has four main openings: the internal acoustic meatus, which is present in the petrous part of the temporal bone, the jugular foramen, hypoglossal canal, and the foramen magnum. Cranial nerves 7 and 8 pass through the internal acoustic meatus. Cranial nerves 9, 10, and 11. The cranial part of the 11th or accessory cranial nerve pass through this jugular foramen as well as the internal jugular vein. The hypoglossal canal gives way to the hypoglossal nerve, the 12th cranial nerve. The medulla oblongata, the vertebral arteries, anterior and posterior spinal arteries, the meningeal layers pass through this foramen magnum as well as the accessory part of the accessory nerve, 11th nerve. The suture present between the frontal and parietal bones is known as the coronal suture. Between the two parietal bones is called the sagittal suture, and the one present between the parietal and the occipital bones is known as the lambdoid suture. And the suture between the temporal and parietal bones is known as the squamous suture. The point of junction between one frontal and two parietal bones is known as the brecma, and the point of junction between two parietal and one occipital bone is known as lambda. If a patient presents with CSF rhinorrhea, that is CSF leaking through the nose after an RTA, road traffic accident, we will suspect the fracture of the anterior cranial fossa because the ethmoid bone forms the roof of the nasal cavity, and it is the connection between the nose and the cranial cavity. If a patient presents with bleeding around the eyes, with raccoon eyes or panda eye, or exophthalmos, that is protrusion of the eyeball due to accumulation of blood behind the eyeball, we will suspect the fracture of the anterior cranial fossa due to damage to the orbital plate of the frontal bone. Similarly, if a patient presents with otorrhea or fluid from the ears, we will suspect fracture of the middle cranial fossa.